Coming back to our next session, the last session of the day, I'd like to call upon Dr. Satyendra Kumar Singh sir to coordinate this session. Thank you.
So we'll be beginning for the last session, and I call upon Dr. Satish Udek sir on the dais. Along with him, a chairperson, Dr. Sachin Kumar Patil sir, and Dr. Naimish Sharaf sir. Please sir. So I will shortly introduce our today's speaker without wasting a time. Sir has completed BMS from College of Ayurveda and Research Center, Pune. He has completed his MD in Rashastra and Bhaishiji Kalpana from YMT Ayurveda College. Sir has worked with marketing manager in Vikram division in Shri Dudh Papeshwar Limited, Mumbai since last 2 years. And previously he has worked in Charak Pharma, Himalaya Drug Pharma, and he had privilege to delivering scientific session as a guest speaker throughout India and sharing his valuable knowledge and insight into a new drug formulations, research and innovations. And he has delivered scientific sessions in national and 8 national and 2 international seminars. He has conducted more than 100 programs for Ayurveda college students, which includes quiz, essay, elocution, presentations, and debate competitions, etc. He has published 2 research papers and on a standard technique of Ayurveda formulations. Now I am introducing today's chairperson. We have Dr. Sachin Kumar Patil sir. Sir is MD PhD Kai Chikitsa. He is HOD and professor in Sumati Bai Shah Ayurveda Medical College. Total UG experience is approximately 19 years, PG teaching experience is 16 years, and PhD experience is of 6 years, sorry. And sir has guided till now 8 PhD students, 30 PG students, and sir is former BOS member for paramedical Ayurveda colleges in MUHS, and former faculty member for postgraduate paraclinical Ayurveda board for MUHS, and local managing committee member for MAM Sumati Bai Shah Ayurvedic College. And sir has awarded as International Best Researcher Award, National Best Research Award, Best Professor Award, Best Head of Department Award in Kai Chikitsa, and Best Teacher Award also. Now shortly I will introduce our co-chairperson, Dr. Naimish sir. Sir has completed his MS Shalya Tantra in 2009 from Rahuri Medical College. Sir is professor in Siddhikala Ayurveda Mahavidyalaya Sangamner, and sir has experience of teaching and training of basic of Ayurveda and Shalya Tantra to foreign students in Spain, Japan and USA. Experienced as a PG teacher since last 5 years. Done various type of social work through Lions Club and achieved award. Done management courses like Entrepreneur Energy Excellence, Commando Leadership Program, and active member of teaching learning community. He is observer post at Department of Surgery, BJ Medical College, observer post at Gastroenterologist Clinic at Dr. Thorat, Pune, observer post at Department of Gastrology, Dinanath Hospital, Pune, and ex-registrar at Galaxy Hospital, Pune. So without wasting a time, I request Dr. Satish Udek sir to start his today's session, and it is need of evidence-based validation for Ayurveda formulations. Thank you, sir.
Namaste. So it's been a pleasure here to be standing in front of all the teaching faculty from Pan India. So it was also a pleasure that I was being introduced from my guru, because Dr. Satyendra sir has teach us in our UG, because we are both from the same college of Ayurveda and Research Center. So first of all, I am very much thankful for the organizers as well as the Shri Dudh Papeshwar Limited. Today the topic is need of evidence-based validation for Ayurveda formulations. I think when it comes for the non-toxicity and the safety parameters of Ayurveda formulations, it's like a big elephant in a closed cabin that nobody is talking about it. Yes, but world is being speaking about it, not only in the national but as well as the international forum. The same when we have been bombarded with many questions about the validity and efficacy of Tinospora cordifolia versus Tinospora crispa. Unfortunately, that same article has been published in internationally acclaimed journal, a peer-reviewed journal, around 6 months back. And it's something a sabbatical for the whole Ayurveda industry. Why? Because Ayurveda industry gives us the quality of the products which are being used for the purpose of each and every physician, that is to treat the patient, to see the health and happiness in every home. So we as a Sri Dudh Papeshwar Limited are working on these parameters, that how it can be formulated, new formulations validated, and as well as without biasness, without having any of the prejudice. As we can see that uncertainty, rigor, the biasness, it's something definitely a tricky parts in the whole industry. So these are few of the recently research articles in peer-reviewed journal, which starts from the patent and proprietary formulations like Asti Poshak in osteopenia, being done 6-month clinical study in NI Jaipur, or Arshaita in SDM Hassan, Amla Pitta Mishran in endoscopic gastritis conducted at Raipur College by one of the top gastroenterologists, Rudrok Chintamani, and cardiac toxicity, how the cardioprotective role of Rudrok Chintamani is, which contains Brothvat Chintamani, Madhumeha Kusmakar in diabetic conditions, in insulin resistance, as well as streptozotocin diabetes mellitus. It's not only about the patent and proprietary formulations. We also have been published many research articles on the Shastrokta Aushadhi like Tamra Bhasma, Suvarna Bhasma. We have done the genotoxicity and mutagenicity study of the Suvarna Bhasma. We have studied the Arogya Vardhani. We have studied the Samanya Shodhan and Vishesh Shodhan Guggul. Rasayog Sagar has given the reference. Then when Shuddhul, it's been, when the Shodhan is being done of the Guggul in Guduchi and Dashmula, it increases its potentiality. So these are the few research articles which has been done. More than 50 research articles we have been published. For the patent and proprietary formulations, 10 clinical, 10 preclinical studies has been published. We are also forthcoming to giving the hands for the upcoming researches, dissertation studies, PhD thesis studies in Pan-India. These are the few numbers, though 14s are enlisted. Why? Because I was being permitted to only 1 slides. 2 we recently proposed and approved from the 2 of the PG students from Department of Kaya Chikitsa from the College of Chennai. And with this, I am coming forward to the evidence-based science. I think in the second session of today's, that is afternoon session, we have seen the evidence-based science, whether it is Dr. Sahane sir, whether it is Dr. Chandrakumar sir. We have seen that Ayurveda has now come to a point that we need to show the whole world that how the formulations are not only safe, but as well as the efficacious. We are having a formulations called as the Kakla Rakshak Yog, is for the management of the hypothyroidism. Acharya Shushruta has mentioned in Sharir Sthana about the Kaklak Pradesh. Dallan Tika has mentioned Kaklakam Galamani Kantike Eti Loke. On this particular terminology, we have invented the product name as the Kakla Rakshak Yog, which contains main ingredient in extract form as Chitrak, Guduchi, Katuka, Kanchanar, and Shuddha Guggul. We have done an experimental study. The study was being conducted at NIRRCH in collaboration with ICMR in Parel, Mumbai. This was the study where we have induced the hypothyroidism with methimazole. Methimazole is generally a drug used to treat the hyperthyroidism, and we have seen the efficacy of the Kakla Rakshak Yog. So there were total 7 groups. 2 of these groups were being given Kakla Rakshak low dose, high dose. 1 was being compared with the thyroxine. The 2 other groups were being given the mixed therapy. Why? Because majority of the time patient coming to us are already being taking any of the allopathic medicines. The purpose was also to see that how the results are being forthcoming. What we have seen, the elevated TSH levels within the 28 days of the treatment has been reduced. The reduced T3 and T4 levels has been increased. We have done the histopathological study of from 1 animal from each group, where we have seen that the Kakla Rakshak Yog also offers the protection to the thyrocytes. So these studies, we concluded that the Kakla Rakshak Yog exhibited a positive effect in reversing methimazole-induced hypothyroidism, as evident from reduction in the TSH and increase in T3 and T4 level. Now coming to one more, we are here in the Atacon with New Horizons in Ayurveda. So we are testing the limits of Ayurveda. We are trying to come out of the limits of Ayurveda. What we did, recently we conducted a clinical study in neurocognitive disorders, also previously called as the dementia. The product name is Medha Sagar Ras, which contains main ingredient as the Mahakalyanak Vati mentioned in Maishajya Ratnavali in Madatte Rogadikar. Also it contains Smriti Sagar Ras, Abrak Basma, Rajata Basma, Acharya Charak Varnit, 4 Medhya Rasayan, Goduchi Shankapushpi, Mandukparni, Yashti Madhu, as well as Ashwadgandha and Goduchi. The principal investigator was Dr. Suhas Shetty sir. The study was conducted in KLE Ayurveda Hospital, Belgavi, Karnataka. 30 patients were being included. Here, the dose was being given was 2 HS. The principal investigator had stated that the patients coming to him from the age group 50 to 70 years were having the problems of anxiety as well as the sleeplessness. To study the sleep quality, we have given the dose as the 2 HS for 60 days. DSM-5, the psychiatric science is following this particular manual, which is called as the Diagnostic and Statistic Manual 5, which gives all the parameters how the diagnosis should be done for any of the psychiatric diseases. So as per DSM-5, the mild NCT was the main criteria, as well as there is a scale called as the MOCA, which is Montreal Cognitive Assessment Scale. In normal individual, its score is above 25. We have included the patients from 18 to 25. What we seen that the MOCA within the 60 days of the treatment has improved. There was one more scale, which is called as the BCRS, Brief Cognitive Rating Scale. These both scale has been mentioned in the DSM-5. The BCRS has been decreased. Now, our principal investigator has also involved one Ayurvedic parameter scale, which was called as the Manas Bhav scale. This Manas Bhav scale was assessed in 2 intensity. That was one with the intensity, second was the frequency. So here we have seen that the improvement, or here we are seeing the reduction in the symptom level, but as well as the patient's condition has also been improved. And coming to the points of sleep quality, there is certain scale called as the Pittsburgh Sleep Quality Index, so PSQI. So we are speaking here, we are discussing here about the sleep quality. It's not only about whether the patient is able to sleep or not, it's about the sleep quality, which has been improved with the treatment period. So after the 2 months of the treatment, we have also done the CBC, ESR, LFT and renal function test, which were being within the normal parameters. So this study has concluded that Medha Sagar Ras safe and effective in age-associated mild neurocognitive disorders as experienced by improvement in MOCA and reduction in BCRS and MB scale. Coming to one more parameters, now we are coming to the premenstrual syndrome. Premenstrual syndrome, we started to promote Asti Poshak in year 2018. Ashray Ashri Sambandh of Asti Dhatu and Vaddosh was the main reason for us. When we started to study the PMS, it was being evident, or we have found out with the many researchers has using calcium supplement, anxiolytic agent, anti-inflammatory agent for treating these disorders. Asti Poshak contains anti-inflammatory agents, Shuddha Gugul, Laksha, Ashwagandha. Asti Poshak has also got anxiolytic agents, Guduchi, Ashwagandha. That was the main intent why we use the Asti Poshak in treatment of the PMS. The study was conducted in Parul University of Ayurveda on 30 patients. Here there was the 3 scales being evaluated: premenstrual tension syndrome scale, VAS, that is visual analog scale, observer scale and self-rating scale. So we have also assessed the WA-LIDD, working ability, location and intensity of pain and dysmenorrhea post the treatment. The females included were from the age group 18 to 40. The dose was being given was 2 tablets twice daily for 60 days. Here we are seeing PMTS VAS scale score. So after the 4 visits, actually the treatment was being given for 60 days. Extra visit was being conducted after 30 days, that is after the total treatment period of 90 days. And we have seen that the symptoms were being reduced. The VAS scale score has included the symptoms like depression, irritability, anxiety, angry outbursts, swelling of extremities, swelling, tenderness of breast, and social withdrawal. We have also studied the observer parameters, where we have seen that the symptoms were being decreased. So this was about the Asti Poshak tablet. Here about the Amla Pitta Mishran in endoscopic gastritis scale conducted at Suyash Hospital by Dr. Manoj Lahoti. I will be highlighting only this point. Rutkanta Daha, the whole modern science is treating with EPS scale. EPS is nothing but bothersome epigastric pain and bothersome epigastric burning. Gaurav and Aruchi, bothersome postprandial fullness and bothersome early satiation. These were the clinical parameters being studied. Coming to the second last slide, that is the cardiac toxicity. Rudrok Chintamani contains main ingredient as the Brothvat Chintamani. This was study where we have seen isoproterenol induced cardiac toxicity and cardiac troponin 1 were being reduced. The drug was being given prior to inducing the cardiac toxicity, and then the extensiveness of the cardiac toxicity was being studied. Post histopathological study, the staining graph is being seen the severity of the damage done to the myocardium, where this is the whole severity. This is Rudrok Chintamani low dose, high dose. This is normal. And lastly, with these 3 Vyadhi Hari Ras, with the letrozole-induced PCOS cases, this is again at ICMR and NIRRCH, where we have seen 3 Vyadhi Hari Ras able to maintain LH-FSH ratio, total testosterone were reduced. Now it's not only about whether the Graafian follicle develop or not, whether corpus luteum is being developed or not, that was the main criteria. And these parameters were being also evident with 3 Vyadhi Hari Ras, which contains main ingredient as the Sutikabaran Ras, Suvarna Yukta, Lata Karanja Bijagana. So we as Sri Dut Papeshwar Limited are being collaborating with many eminent institutes pan-India. These are the few of the institutes. And we are taking our utmost care that how the safe, standardized and efficacious medicines can be given in each and every Ayurveda physician, so that the ultimate aim of our to see each and every person healthy and happy, that our motto is health, happiness, Ayurveda forever. Thank you once again for giving me this opportunity. Jai Dhanvantari, Jai Ayurveda. Namaskar.
That was a nice presentation, and because of time constraint, we have just a word, like we will call sir in next CME definitely, and a detailed presentation we will need that. And as many of the awardees are giving call, they have their train and flights. So without wasting a time, I would call the session we are like concluding. And I will like to facilitate, I will call Dr. Hiremet Sangameshwar sir on the dais. Sir, please felicitate Dr. Satish Udek sir. And after that, I would like to call Dr. Prashant Khade sir, ATA Coordinator Maharashtra. Please come on the stage. Dr. Khade sir is Executive Chairman of the ATA, and I am requesting Khade sir to felicitate Dr. Sachin Kumar Patil sir. Again, I request Khade sir to felicitate Dr. Nimish Sharaf sir.
Dr. Prashant Khade sir to kindly felicitate our coordinator, Dr. Satendra Kumar Singh sir.
I request Dr. Khade sir, please felicitate our coordinator, Dr. Ubay Kiran madam, please. They in charge of this session. Nice work, madam. Today you have made very good job. Then Dr. Damle also, sir. Please, Dr. Damle sir. Nice work, sir. Thank you.
We will be moving on to the prize distribution ceremony now. For that, thank you. For that, I'll call upon Dr. Ujjwala Pawar ma'am and Dr. Rahul Kambade sir. Dr. Ujjwala Pawar ma'am and Dr. Rahul Kambade sir.